The next question is, should community health assessment be standardized across communities, perhaps using health department accreditation as a vehicle for doing so? Certainly there's an argument to be made for standardizing community health assessments, say within a state, at least across counties, so that the assessments between counties can be compared, for example. There is also some efficiency in standardization in that each county might be using, for example, a similar tool, survey instrument, similar indicators, and that can be make things smoother for the individual counties and communities doing the assessments. It also can help, say, a state health department who might be providing support to those doing these assessments, in that people are doing them with the same general approach, and data can be prepared to facilitate the assessments, etc. That said, there are a lot of tools out there. You've read about some of these in the reading as well as some of the lecture material. There are differences in definitions and how the approaches are taken with these different tools. The next slide shows, in fact, from a 2008 NACCHO survey, the National Profile of Local Health Departments, the particular tools that are used by local health departments for community health assessment. And in some cases, the dark blue line represents how many of the local health departments responding to the survey actually used this particular tool or document, say, as a reference for their community health assessment. The green bar shows the local health departments that, in fact, may have used the particular tool, but they also implemented certain things with other tools. And then the small blue bars show that the only tool that was used was the particular one listed on the left. And you can see here that many different tools were used. Healthy People was often used as a reference. The MAP tool was used a fair amount. State-specific, in other words, tools developed by an individual state for its counties and local health departments that was not necessarily one of the existing standardized approaches. That's what that refers to. And you can see also here some of the other tools and their frequency of use. So the next question, who defines the community that is the object of a community health assessment? The next slide talks a bit about, shows a couple of specific questions that were asked. I defined Bethlehem, Pennsylvania, and Northampton County as my community. Must we look at a more defined community, as in a smaller demographic area within Bethlehem, for example, South Bethlehem? Should the population be defined into a smaller subset, for example, HIV-positive Latino populations between the age of 12 and 22? Is the community that I'm choosing too big or too small? And another question related to, if there are two small towns that are adjacent to each other, might they benefit by joining forces and forming one community to assess as a whole? Well, the answer to this question is varied, but in some places the assessments have to be done for a certain community. It may be in some states that it's required to be done for individual counties. That's the most frequent way that the community assessments are done statewide. The Affordable Care Act defines generally how the hospital can constitute the area, the community that it will assess, typically referring to either a geographic area or trying to identify the area that for which it provides services. The answers to the questions under Affordable Care Act will talk a little bit more about that. But anyway, suffice it to say that the definition, there's no hard and fast rule about defining the community. We will see some advantages and disadvantages during this course of using a fairly standardized geographic definition in terms of getting data, and some of the difficulties if that is not used. So they're both practical considerations related to data, as well as practical considerations related to getting communities engaged and interested in the assessment itself. So the next question was, how do I determine if a community is healthy? How is health operationally defined? What about mental health status? If you could choose one key factor to determine a community's health, what would it be? Well, this is an interesting question, and many people have thought about this. There are various indicators or markers that are used for monitoring health, mortality data, for example, life expectancy, the overall age-adjusted mortality rate. Those are frequently used. There are some composite measures that have been developed which actually combine usually a measure of life expectancy and some measure of quality of life for people that may relate to their functional capabilities. That is the most frequent way in which health is defined operationally. Another approach is to use a cluster of different indicators, some related to mortality, some related to quality of life and function of people within the community, and others related to risk factors within the community. That's the approach taken, for example, by the county health rankings, which are included in the resources in this in the course materials, and about which we will talk more later. So, which health status indicators have a major influence on the health outcomes of a population? This is I'm a little uncertain about this question, exactly what is meant here. Health status indicators do usually refer to mortality, prevalence of disease, incidence of disease, functional status of members of the community or of a population, quality of life, ability to carry out activities of daily living. So those are some examples of health status indicators, and those kinds of indicators are often used as a marker for health outcomes within the community. So in some ways, health status indicators are used to monitor health outcomes and to conduct rankings in populations. And finally, it was noted that by one of the students that there's been a shift from focusing on community needs to community assets. This is a topic that will be addressed during Module 3 of this course. And yes, there has been some emphasis made on trying to look more at community assets and what can be brought to bear to help improve the health of a community, rather than focusing purely on what the needs are of a community.